Thank you for tuning in to tonight's presentation. This presentation is sponsored by KSB Community Health. My name is Connor Skoumal. I'm a PT physical therapist at KSB Hospital, and today's presentation is going to be on exercises to prevent and decrease shoulder pain. So the learning objectives for this presentation are to demonstrate an understanding of the anatomy and biomechanics of the shoulder, identify common shoulder impairments seen in physical therapy, and to integrate a shoulder injury prevention program to create a strong, mobile, and healthy shoulder. So how common is shoulder pain? So I know personally I've been practicing now for 2 years as a clinician, and shoulder pain is definitely second most common impairment that I see behind low back pain, and that kind of corresponds to some of the information that I found. So as of 2016 in the US, 33.2% of doctor visits for musculoskeletal pain are for shoulder pain. And individuals over the age of 25, the prevalence for shoulder pain is 20.9% and only second to low back pain out of all musculoskeletal pain. So that kind of piggybacks off of what I've seen in the clinic, and it's a serious condition. You know, these injuries, they go on for a long time if they're not treated accordingly. So it's important to understand that. Next, we'll talk about the anatomy. So first, the glenohumeral joint. So that's the ball and socket joint that most of you know. It's similar to a golf ball on a tee. So the golf ball is the humeral head of the humerus there, and then it sits in the glenoid of the shoulder. So there's not a lot of surface area there. It's kind of a bigger ball sitting on a small little thing. So some of the additional structures in the shoulder help support that golf ball on the tee. For example, we have passive structures such as ligamentous support and the labrum. And the labrum actually increases the glenoid depth by 75% vertically and 50% horizontally. So it provides that additional stability. And then you have the long head of the biceps, which comes anteriorly in the front of the shoulder, and that attaches to the anterior aspect of the glenohumeral joint and the labrum. So the scapula or shoulder blade is next. There's a lot of different origins of muscles that that start on the scapula, including the rotator cuff and deltoid. So dynamic stability of the shoulder joint is created through force coupling, and force coupling is essentially two parallel forces of equal magnitude that act in opposite directions, and this allows for stability and rotation. So if you can see in the picture here to the right, the deltoid is what pulls up on the shoulder, and that's going to put the golf ball or the humeral head more superiorly towards the top. And then you have, to counteract that, as that force couple, you have the rotator cuff tendons in orange that kind of stabilize that shoulder, and stabilize it into the joint, kind of pull it down and in. So when you don't have, commonly what we see is you don't have a really strong rotator cuff, so your deltoid and your upper trap muscle, they kind of overpower the joint and cause your humeral head to translate superiorly, causing a lot of subacromial impingement. And I'll kind of get into that, but just wanted you guys to understand how it works and why it's important to have a good, strong shoulder for not only just global strength, but keeping the humeral head in that glenoid, how it should be sitting. And then additionally, the scapula needs to be able to rotate upwards to obtain full shoulder elevation. So next we talked about the scapula, but there's also this joint called the scapulothoracic joint. Now this is a pseudo joint. It's not a real joint. It's not a real synovial joint, but it's the articulation between the thorax and the scapula. And this is essential to have good mobility and efficiency to prevent shoulder impingement. And we'll talk about some exercises that kind of help promote that joint to move and glide and slide how it should, as it relates to overhead lifting and things like that with the shoulder. So in terms of biomechanics, let's talk about the subacromial space. So that's a space below the acromion, which is that very top part of the picture there on the right, which is part of the scapula, and it's above the glenohumeral joint, obviously. So within this space, you have the subacromial bursa, supraspinatus tendon, which is a rotator cuff tendon, and the long head of the biceps. You need a combination of rotator cuff strength, shoulder mobility, scapular control, and good posture to maintain proper spacing. So very common to see shoulder impingement. It's usually in the subacromial space. And we talked about how it's important to have that humeral head in a good position. We don't want it too high up because it's going to obviously cause more pinching in the top part of that joint, which when you go overhead, that joint gets smaller as is, and then that's when you get the impingement and more degeneration to the rotator cuff. So important to understand that. Posture is very important in terms of getting that full range of motion when you are lifting overhead. So normal posture with shoulder flexion or just lifting forward, you need to have good scapular upward rotation. So that's kind of that the green arrow as it first comes up to the side. You need to have good upward rotation. You need to have good external rotation. That's basically the hugging of the scapula on the thorax to prevent, or actually kind of more pulling back towards the spine, making sure that it doesn't, you don't get like a wing scapula or things like that. And then also posterior tilting. So that's just if the scapula was posterior tilted kind of towards us here, instead of rolling forward and having that forward shoulder. So posture, like I said, very important. There's a lot of different effects of poor posture. So one thing is increased thoracic spine flexion. That causes that scapula to rotate anteriorly. And then also it causes it to go up. So that's something we don't want, and it decreases subacromial space. Also, poor posture causes an adaptively shortened pec minor. And this causes anterior tilt and internal rotation again. And that causes decreased subacromial space. So overall, that poor posture can decrease your shoulder range of motion by, a study I found 17.7 degrees difference between a slouch versus an erect posture in terms of how much overhead motion you can get. So very important to have good posture for not only range of motion, but shoulder health. Next, we'll talk about some common shoulder impairments that are seen in physical therapy. One of the most common is rotator cuff tendinopathy. So that's basically just chronic or acute inflammation of the rotator cuff tendon as it attaches onto the humeral head. Like I said, there's 4 tendons there that can be involved. This is really common in overhead workers and athletes. Shoulder impingement is also another very common diagnosis that we see. Tendons of the rotator cuff become impinged as they pass through subacromial space. We talked about that. And you can also have the acromion bursa and the biceps tendon and or the bicep tendon could be involved. Shoulder instability, so that's basically laxity or disruption of the passive elements of the glenohumeral joint. We talked about those. So that would be more of your ligaments, your labrum, some of those non-contractile tissues. They can become lax along with shoulder weakness and cause instability, and subluxation, dislocation, things like that can occur. Adhesive capsulitis, that's the frozen shoulder that many of you have probably heard of. Basically, it's an adhesion of that joint capsule that limits your overall range of motion. It can be painful, stiff. Scapular dyskinesis, that's basically poor movement of the scapula in terms of position and just global motion. And then lastly, biceps tendinopathy, similar presentation to shoulder impingement. So the biceps tendon has some acute or chronic inflammation, and you're going to get usually like anterior or front of shoulder discomfort. So next, we're going to talk about some exercises to both increase stability, to increase strength and mobility. So we'll talk about the strengthening exercises first. So first one is the full can. That's that image on the top left, right in the middle of the screen. When you do the full can, you want to be basically you're not going straight forward, but you're not going straight out to the side. You're right in between. You're at about a 45-degree angle, and you're just lifting up. She's got weights in this picture. You don't need weights. You can use a soup can, things like that to give you some resistance. You just don't want to make sure you don't want to shrug your shoulders up. You kind of want to stay with your shoulders drawn back a little bit, but this is really good for strengthening the supraspinatus, that tendon that comes through the subacromial space. We need that strong, and this has been found through research to be a really good exercise for that. In terms of how many repetitions to do, we want to kind of go by 3 by 12. So 3 sets of 12 is a really good number to increase your strength. In terms of resistance, you want those. What I always tell my patients is by the last few repetitions of each set, you should be fatigued. It should be between moderate and hard in terms of difficulty. So that way you're maintaining good form, but also creating resistance and tension to create those changes to the tendon and the muscle through that strengthening intervention. Next, we have the prone T. So that's the far picture on the right. Well, you can do this on the edge of a couch. You can do it on your bed, edge of your bed. But basically, you're just coming straight out to the side and squeezing your shoulder blade back. So you're keeping your arm straight the whole time. She's got a weight in this picture. Once again, you don't need weight necessarily. This is a tough one. I know I start off most of my patients without weight with this because it's hard. It's not easy to do. Once you get better, you can add a soup can, things like that. And same parameters. Do 3 by 12. You want moderate to hard by the last couple repetitions of each set. Next, we have sideline external rotation with the towel. So you just tuck a towel in your armpit there, lay on your side, and the side that you're working is up top here. And so for this picture, it's your left. And all you're doing is rotating your shoulder up and back down. This one's a little easier, so you probably need a little bit of resistance with this, but you want to just make sure you don't roll your shoulder back. You just stand on your side and going up to about where that picture shows. A couple more exercises to increase strength. We have your push-up plus. So that's the picture right in the middle with the woman doing the push-up. So it's just like a standard push-up, but once you get to the top, you actually are going to roll your shoulder back and create kind of a bad posture, really. But what you're doing is you're protracting your scapula. You're activating your serratus anterior, which is an important muscle for that scapulothoracic joint. We need that healthy, and we need that to move well. So this is a good strengthening exercise for that. Now, what I usually start doing on the ground is really difficult. I just start my patients on the wall just to get the motion down. Do a push-up off the wall and then round your back off. Once you get good at that, you can progress to like a countertop and kind of work your way down lower to get more resistance as you go against gravity and use your body weight more. Next is the prone Y. So let's picture the top right. Basically, all you're doing for this, you're making a Y. So you're laying on your stomach. I like to do it one arm at a time. That way you can do it off the edge of a couch or bed, just like your prone T. And you're just coming up and squeezing the top. This is really good for middle and low trap strengthening, which is important for just global scapular health and scapular movement to get that upward rotation that we talked about in the earlier slides. Finally, for strengthening, we have the prone I. So once again, on your stomach, keeping your arm straight, you're keeping it close, tucked close to your side, and you're just squeezing back. Exercises to increase mobility. So one of the exercises we want to do is to increase the flexibility or mobility of the anterior chest wall. So the doorway pec stretch is one I really like to do. That's the first picture right in the middle here. The woman, she's got her arm at about a 90-90 angle, and she's standing. Now we don't want you to lean forward very hard into the wall. That's going to cause your shoulder and tilt your scapula forward. We want to keep it drawn back. So what I like to do is just rotate. So she's rotating her chest away from the arm, and that's going to get a good stretch in the front. For these stretches, specifically this one, you want to do about 3 sets of 30 seconds. So we want to hold these stretches, and I would do that a couple times a day at least. Next is wand flexion. So that's the top right picture. This exercise is good for just maintaining or improving your shoulder range of motion, specifically in the sagittal plane. It's also going to help if you have one arm that might be a little tighter than the other. What you can do is grab a cane, a dowel rod, a broomstick, something that's a nice straight light thing, and you're basically just taking it overhead. You're going overhead. Let's say your right shoulder is a little tighter than your left. You can actually kind of actively just use your left shoulder and kind of just go along for the ride with your right. So some of those contractile tissues can relax. You can really get a good end range stretch. So really good, just overall range of motion exercise. I use these for people with limited motion post-operatively as I'm trying to get their range of motion back. This is a good one to keep your shoulder mobility efficient. For parameters, I usually tell my patients to do 10 of these or so and hold it for about 5 seconds at that end range. And you can do this 2 to 3 times a day. Shoulder abduction wall slide is next. That's the bottom right picture. All the individual there is doing is he's standing at the wall. His arm is directly at the side. He's just sliding his arm straight up. So obviously the closer you get to the wall, the more of a stretch you can get and the more overhead you can go. You're going to keep your arm straight the whole time. Once again, hold it for 3 sets of 30 seconds to get a good stretch and more of that frontal plane of motion. Then we have the shoulder flexion wall slide. So now we're coming straight forward. So it's just like the abduction wall slide, but instead we're in a different plane of motion. We're going straight forward. And that's the picture to the right there with the individual in the blue shirt. I like to keep the elbow straight the whole time, and you can kind of get a little bit of a lean into the wall to get a nice stretch of your lats and some of the joint capsule there. So 3 sets of 30 seconds for this one a couple times a day. And then finally we have the internal rotation towel stretch. So I tell my patients to do this one right after you get out of the shower, dry off, make sure you're in a safe place on the floor. You know, you're not going to slip or anything. And those muscles are nice and warmed up. You can grab a towel. If you want to stretch your, let's say you want to stretch your left side, you're going to do what the photo or the picture says. So your left arm goes behind your back by your belt line. Right arm goes behind your back, but above your head. And you're holding onto the towel, and basically you're pulling up with your right arm overhead while you're kind of going along for the right and the left. So this is going to help if you're limited with, you know, undoing your bra strap or tucking in your shirt. These are the kind of this exercise is really good for improving that specific range of motion of internal rotation. So just a disclaimer, just if you do have any significant pain with any of these exercises, just don't do them. If you do have the pain, contact your physician or physical therapist for a more thorough evaluation. And additionally, if you have any acute shoulder pain with or without a mechanism of injury, please contact your physician. Like I said, this is I see it a lot, shoulder pain a lot. And usually people come in and it's chronic shoulder pain. They've had it for years. And a lot of times those people, they don't get to 100%. It's very difficult to get them back to 100%. The earlier you catch these things and get them addressed, the better chance you have of keeping that shoulder healthy and returning to your prior level of functioning. So if you have any questions, don't hesitate to reach out to your physician or contact KSB's Rehab Services Department. You can also leave a comment on this video, and I can get back to you accordingly. Thank you for watching.